pharmaceutical industry is very rich, very profitable, and they have influence on medicine very widely. They're also connected with the media, and they'll have a lot of influence on what goes out on television and newspapers. They're connected to politicians. They'll sponsor politicians, fund them through lobbying, and they can be connected with regulatory authorities. So they have very wide-ranging power.
Pharmaceutical industry has never been as strong as it is today. And I fear that what happened today is going to become the standard practice. Before, pharmaceutical companies were telling us we need patents, we need money, etc., because we invest in research and development. They didn't invest in research and development, and we know it, and it is public.
The global COVID pandemic really just exposed how bad the system is. The system has not been designed for communities, for people living with HIV, for people with chronic disease, because there's no incentive in the system to take care of masses of people without profit. We can see with the COVID vaccine that there were incentives because all of a sudden this disease was affecting the whole globe and not just a particular country or particular socioeconomic group. Whereas with TB and HIV, we have been fighting for years for access to a cure, for better pricing.
Initially, COVAX was set up as a facility that will ensure equitable access to vaccines for both high-income countries as well as low-income countries. It presented as some sort of hope that we will be able to be having some level of access through the facility. So that was the initial reaction. The fears that we had actually came to pass. We saw the high-income countries pre-booked the vaccines, and the initial commitments that they had to distribute this through COVAX, they renegated on that.
We've seen vast profits made during the COVID epidemic, and the sales of the Pfizer vaccine were the highest sales ever seen for any drug in history. And the profits will be vast because it's fundamentally a $1 vaccine that's being sold for $20. The profit is huge, and the investment in it was mainly from governments. The US government, the UK government, Europe. So the company haven't even paid for the development, but they're profiting from the sales.
I think we never imagined 5 years ago that borders would be closed all of a sudden and that we would not be able to access medicines from any country. And the reliance on India and on these big producing countries has not saved us this time. And we've seen that now we need to go a step further towards decolonizing the whole global access movement and the whole global health movement and decolonizing the way that we think about access.
In the beginning of 2020, a law bill that was supported by 11 parliamentarians from different parties, and we managed to give a lot of visibility to this bill. So the Brazilian Congress became a space where we could really discuss, how to overcome monopolies. And then we started to do a very strong campaign to get the bill approved. So we had to be creative and do things differently. So one of the things we have done, it was a lighting projection in the building of the parliament the day before the voting sessions. And it was amazing because a lot of parliamentarians, they were taking pictures of it and posting it on their social media. So this helped us to keep the topic in the agenda. And we also did, close to some of the voting sessions, sound truck with a song that we created to, stimulate parliamentarians to vote in favor of this change in the patent law. As we know, approving a new law, it's quite difficult and takes a lot of time.
Civil society was fundamental for the outcome of this decision at the STF, our Supreme Court, because that was supported by a lot of organizations in Brazil, and they came from other civil society organizations, patient movements, and academia, and also the press. The press was fundamental. So this conjunction of agents was fundamental for us to achieve this final outcome in Brazil.
In this case, we had so much public support and so much support inside the parliament that in the first voting session at the Senate, we had 73% support from senators. With this new law, what changes is basically every time there is a new health emergency affecting Brazilian population, The government will quickly do a list of all technologies that are relevant to defeat this new disease or this health emergency, vaccines, diagnostics, equipment. With this list, they will move to the next stage, which is removing all patent monopolies from all those technologies. So this is very important to avoid a situation in which only one company supplies something like a vaccine or a treatment, because when we have an emergency, especially an international one, having only one supplier means that, we need to pay whatever price the company will charge.
There's a lot of things that we still need for the HIV and AIDS program, including the latest technology on the ARV and the other healthcare issue. If we can make this government procurement more efficient, media is supporting us a lot. In 2019, one of the big media in Indonesia is releasing the special reportage on ARV pricing. They put the face of the health minister in the front page with the pill. After his face on the front page of the big media in Indonesia, yeah. And then the health minister instructed his team that please give Aditya what they want. I don't want my face again in the front page. So when we start our organization in 2011, actually the price of the ARV is very high. It's around $35 US dollar. And now for those medicines, it's around $6, 6.7.
South Africa. I was diagnosed with HIV in the year 2000, and I started to join community support groups. And from there, that's when I learned a lot about HIV, how to live with HIV. So that taught me to say community are doing more than what government is doing. And for people like me who's openly living with HIV, always in touch with the community, and that's where things are happening. And for us in South Africa to access ARVs, it took community, it took activists to take the government to court, since now we have ARVs in South Africa and we are living. In the data that we got in 2019 is that 60% of people who are dying, who are living with HIV, are dying of TB. While TB has killed so many people more than COVID, then that showed us that the government can be able to respond.
Even intellectual property is a very powerful tool that can be helpful, especially during such a time like war or any other catastrophe. We switched to some new initiatives and new activities, such as IP waiver for medicines with the usage of TRIPS flexibilities and TRIPS Article 73. Normal routes are not available today because we don't have any air connection. It was a challenge to find the way how to actually deliver those drugs to Ukraine, and our partners from Poland have helped us with that. They are delivered through the border with Poland to Ukraine. It took about 10 days to deliver them to all other regions, and there was a huge work done. My colleagues from 100% Life, also the Public Health Center in Ukraine. Basically, there were some arrangements made with Ukrainian Railway. They are absolutely, I would say heroes, because actually those trains were going to absolutely dangerous destinations. However, they were delivering whatever was necessary to be delivered. And also there were some logistic companies and some other partners who were helping and assisting a lot.
Patents are granted for things that are not supposed to be granted, etc. And the pharmaceutical industry has no interest to touch this. It's the Pandora box. So they prefer to put them on voluntary licenses, at least for these diseases that have media attention. But at the same time, in these same poor countries, the same companies are making a lot of profits on cardiovascular diseases, on antibiotics, on cancer drugs, etc.
Voluntary license are just a tool used by business to do business. It's a way to control markets, deal with competition, organize production and markets. The access to medicine crowd, some of them have been trying to use this specific tool to try to advance the access agenda. But there are a lot of limitations, and I think it is time that we realize that this legal tool is doing much more than what the tiny part we were looking at. The discussion we need to have, it's not so much about voluntary license, it's what is going on, who is doing what. Can we have transparency? Can we have democratic control over innovation and access?
A global summit like this is important because it brings together the activists to be able to reflect around these issues, to be able to hear from other countries. What are the experiences? Do we have some progress? What can we learn? How can we work together? There are so many lessons from the conference that are very relevant to the Kenyan experience, and I think that one just gives us a renewed energy to be able to go back and continue with the work.
We need a people's movement because people should have a say in their own lives. And then also more broadly that health is not limited simply to access healthcare, though that's important, but also that they should be able to participate in democratic processes for governing many other dimensions of life, including the political economy and indeed the global political economy.
I think what COVID has really been showing us over the past 2 years is that we've been relying a lot on solidarity and that the system is broken and solidarity is not sufficient anymore to enable to access the medicines that we need in developing countries. So I think there's a global movement now to reach out to generic producers in developing countries so that we start becoming more self-sufficient. The vaccines crisis has really shown the failure of the system as it is today.